Hi, I'm Dr. Ajan Juricic. I'm a low vision optometrist in Toronto, Canada, and I've taken the last 26 years and put together all my years of experience to find the best vision solutions for my patients. And I'm here to share with you my favorite solutions. So when it comes to eye health, some people don't need to see me for a low vision exam, but I find that many people might be actually searching for solutions because their eyes are really dry. And I'm finding over the last 2 years, especially with COVID, more people are on the computer screen and they're complaining more and more that their eyes are dry. And the way you can tell if your eyes are dry is, one, they can feel dry, gritty, sandy. That's easy, you know something's going on. However, a lot of people, when they have dryness of their eyes are actually tearing up. So when they come to see myself or any of my colleagues for an eye examination and they tell us that they think they have dry eyes, or they think that their eyes are watering too much and we say it's because they have dryness, they sometimes look at us really perplexed, thinking, how can it be that my eyes are dry when they're actually watering all the time? And I'll actually tell you why. So when it comes to dryness, it's either that you're not making enough of the right components of the tears. So if you don't make enough of the watery tears, then that can cause that gritty, sandy feeling. Now, what a lot of people don't know, the watery component is just one of 3 components of your tear layer. The other 2 are the mucousy layer, as well as the oily layer or the fatty layer of your tears. And if you don't make enough of the fatty layer, that part is supposed to be there to keep the tears from evaporating. So if you don't make that lipidy or oily component to your tears, you actually have these dry spots that we can see when we actually check someone's eyes with this fancy microscope of a piece of equipment that we call a slit lamp. And we actually see the dry spots when we've actually put a special yellow dye in your eyes. So what will happen is you'll get these dry spots, or you also find that when you blink, it's almost like a film is over your eyes, that you're actually smearing this film layer, and if you blink, all of a sudden it clears up and then it goes blurry. Well, that's because you don't make enough of the fatty, oily component. And if you're using regular eye drops that you found over the counter, you're probably saying they don't do very much. You put them in, and after 10-15 minutes, it feels like you didn't do anything. And that's because they don't have the lipid enhancing component. So when it comes to dryness, there are various forms of eye drops. And I'll let you know, quite a few that are out on the market that you'll find on the store shelves might be formulations that have been around for years, if not over a decade. So when I look at the eyes, I actually will cater the solution based on what I'm seeing. And not everybody has the liberty to be able to go see their eye doctor, and they're going to try to do their own remedy. So we've created a quiz that will help determine which eye drop may be best for you. Now, always the best is to go see your eye care professional. Go see your optometrist, or if you're seeing your ophthalmologist, let them know that you're having issues with your eyes, and they can do some special tests. And most often there are drops that can help. Now, some people who have very severe eyes, they need to see a dry eye specialist. So I do have colleagues that I sometimes refer my patients to when just the drops alone don't make a difference, and they have to go to more enhancing therapies to help with the dryness. But please do the quiz. Let's see which of these drops might be the best for you based on what we determine is causing your dryness.